So when I first returned to New Zealand last year, one of the things someone asked me was, "How has this fellowship changed?" And I said, "It's changed my career." And I think for me, what I was surprised about was it wasn't just the sim and the education side of the fellowship, but so much more of that like management and effective change piece and leadership that the fellowship brought. And so for me as a clinician, I've actually I feel like I use it every day, like being more present in conversations, um, analyzing things from people's perspective or their frames, shall we say. And so for me, it's not it's really changed in my practice with my simulation and my education, but I think just my day to day work, being present on the floor, being a leader on the floor, and my role as a doctor, I feel like that's really enhanced my practice as well. And I honestly feel like a different doctor since returning from my fellowship.
I'm going to do a simulation on a critically unwell patient today. The scenario is the ambulance is going to call you at your rural hospital ED with concern that they've got a patient with anaphylaxis. The ambulance has arrived and here is your patient who has got obvious urticarial rash and is struggling to breathe. Please proceed.
Cardiac, supporting his own airway, and his blood pressure is about 95 of 60.
My project that I worked on with for the fellowship was creating a deteriorating patient study day for our rural hospital, particularly looking at the challenges we face in rural, like limited staff, limited access, those kind of high fidelity but low frequency situations, and we don't have an ICU team to call. So my fellowship project was to design a deteriorating patient study day, and I've since that has gone live. So we've implemented that within our organisation. I think the thing I took away the most was like, like when I came back and I spoke to my nurse managers and my HOD, my head of department to find out actually what was needed, I realized that I have to change my teaching style and my simulation content based on what's needed. Sort of prior to going to CMS, I'd kind of be like, oh, we'll do a VT arrest today or something else. But what I learned was actually communication skills was what our team needed, or just simply recognizing the deteriorating patient. And that's why I've kind of changed my way of thinking that actually I will design sims based on what's needed at the time. Um, and so that was a bit of a change in practice for me. Also, I think looking at people's perspective or frames, sometimes I'd always be like, well, why aren't people doing what they're meant to be doing? Or surely they just need to follow the algorithm or the guideline. And I think my debriefing style has really changed to really understand people's why. And that's been able to shape me debrief in a more meaningful way. Part of my teaching is right from undergraduate medical students through to senior colleagues, and also interprofessionally. I've really, part of my project was not just doctors, but doing interprofessional simulation. So nursing, allied health, and doctors, just because we are a small team in our rural hospital. Prior to this, I think a lot of people were scared to do sim. So I think like learning more about the pre-brief and not trying to trick people and actually giving them the resources prior to the study day and prior to our simulation day. Learners have left feeling more empowered and not scared, and actually they've enjoyed the simulation experience, which obviously I've always enjoyed. That's why I do it. But I think again that change in practice for me, making sure everyone's well prepared and we're not trying to trick them with scary sims, making sure it's a safe psychological environment for them to practice. Like they felt empowered, they felt ready to deal with an emergency after coming to this course. They felt encouraged, and yeah, I think that's been really positive feedback for me from the learners. So for me, it's opened up heaps of doors. New Zealand's quite a small country, so I when I got back from my fellowship in May of last year, people knew that I'd been, and so I was invited to come in for help be a co-facilitator on some simulation courses that the Otago University ran, particularly in rural trauma. And so they heard that I'd been to CMS. They said, "We want you on the faculty." So since I've been able to be involved in the Rural Interprofessional Simulation Centre, which is run out of the Otago University, who run rural-based simulation courses. I also have a role with the Auckland University, more for medical students. But having had the CMS experience, we talk the same language. They are very happy for me to use their simulation suite in the Auckland University, which is incredible. And I've been able to develop courses through that for this cohort of medical students that I supervise, so the rural medical students. But I think just having that kind of being able to say I had a fellowship with CMS has really like opened doors for me in that simulation space. And I think for me as an educator, I've always been passionate about simulation, but this has allowed me to sort of wear that with pride. there's probably not a week that doesn't go by that we're not doing some sort of sim, whether that's with our medical students or our team, and even just small, ad hoc sims in our hospital. Again, we'll be pragmatic with our rural team. If there's not much happening, we'll try and do some teaching. I feel like my passion is that every clinician works at top of scope and, B's clinical excellence. And so it doesn't matter if you're a rural patient, you still get the best care because those rural clinicians know how to do ABCDE well. So for me, it's just ensuring that, yeah, staff are skilled well so patients have good outcomes. So I think for me, it's all about empowering people to be the best that they can be, and simulation's a key skill for that. When I came to the fellowship, I thought it would be very much just like to teach you how to do the simulation, like how do you design sim, how do you debrief. And yes, we got there, but probably the biggest takeaway was more like the kind of leadership skills that they gave you throughout the course and that kind of change management. So, how do you actually navigate? Before I'd gone to CMS, I'd been trying to sort of get a deteriorating patient study day off the ground before I even left. But I kind of hit roadblocks with management that they weren't going to free up nurses. It's probably that change management piece and leadership, just learning those skills, finding out what was important to the nurses and the nurse managers, and saying, well, actually, this simulation course is going to improve their skills, it's going to improve work attendance. Really has shaped me being able to implement things, and not only in education, just in other sort of policy practices and things. And it was amazing. We ran a mass casualty incident simulation with our medical students and our local fire brigade and ambulance, because I also volunteer in the pre-hospital space. And we also had actors and stuff as well. So I felt confident after like seeing what we'd done at CMS that you can use real actors rather than mannequins. And then actually doing it in the field, like we had a car rollover in a local paddock. We were able to do it in a safe environment. Um, Obviously, we're in a live like field with real power lines and things. So not only did we have the normal safety stuff, but the actual real safety stuff. Being able to plan something that big, I wouldn't have been able to do without having gone through CMS. And then it was such a highlight for the team. Like the medical students felt like this was a memorable part for their career, that they've got to do this like pretend simulation in real life. It was a mass casualty trauma type situation, getting to use the real equipment from the ambulance and things. So I think that was, yeah, pretty special for me that they enjoyed it so much. But also, I was able to bring that simulation to a real life situation. I think it was so successful because it was so structured. I was doing some kind of self-taught before I went to CMS, and like it wasn't bad, but like it wasn't terrible, but it definitely wasn't what it is now. And I think that that's what CMS the values, like it's embedded those key practices of psychological safety, you know, good debriefing, good judgment, the planning phase, which I probably didn't put into as much effort prior to coming to CMS, like actually writing down what's needed and how we're going to achieve these, what are the learning outcomes and how we're going to achieve these. There's a conference next year being held in Wellington, and it's the World Rural Conference, and it's been held in Wellington. And I've been accepted, and it's on my deteriorating patient study day, and about embedding the interprofessional pathway and simulation. So I'm actually going to be doing a 20-minute presentation at that conference. And again, that's based on my experience from CMS. So it's not so much I'm not talking about my CMS experience. I'm talking about the deteriorating patient study day that I've mentioned, which was my project from my fellowship. But I'm been asked to talk. Yeah, I've been accepted to talk on that and how that we've embedded that within our practice. So yeah, again, it has opened lots of doors for me.